This is a demonstration of how to perform a rapid response COVID-19 antigen saliva test. The test kit provides a saliva collection pen with test strip and an extraction buffer cap. Materials required but not provided in the test kit: clock, timer, or stopwatch. Bring all testing materials and specimens to room temperature, 18 to 30 degrees Celsius, before use. Open the pouch and remove the saliva collection pen and the extraction buffer cap from the packaging. Materials should be standing upright. Label the collection pen with your name, if necessary. Clear your throat, then cough deeply 4 times with your mouth closed. This will bring up saliva from the throat to the mouth. Remove the plastic guard from the tip of the saliva collection pen. Place the saliva collection pen in your mouth on top of the tongue. Then close your mouth and hold for 2 minutes. Do not bite, chew, or suck on the sponge. Hold the saliva collection pen vertically and place it into the extraction buffer cap. Press down to break the seal of the buffer cap, releasing the buffer solution. Start the timer immediately after breaking the seal. Read the results at 15 minutes. A positive result shows 2 lines: line in control region, C, and any visible line in test region, T. Note, a very faint line in the test region, T, is also considered to be positive. A negative result shows 1 line in control region, C, and no apparent line in test region, T. An invalid result shows no line in control region, C. Results from any test which has not produced a control band at the specified read time must be discarded. Please review the procedure and repeat with a new test. If the problem persists, discontinue using the kit immediately and contact your local distributor. Thank you for choosing Rapid Response.